Right. Hi, I'm Chelsea, and we are going to be demonstrating NG tube insertion. Okay, so first I would check my doctor's order to see what size tubing needs to be used for this patient. I would also make sure there is no allergies and see the reason why our patient is getting, which could either be for suction or feeding. Okay, in today's case, we're going to be hooking it up to the suction. So once I've verified my orders, I would go into my patient's room, make sure he was up in high Fowler's position. I would make sure all my materials were here. Okay, then we're going to check both of his nares for patency to pick which one we want to use. Okay. Then I would wash my hands and put on gloves. Tubing. We want to measure from his nose to the top of his ear, and then from the top of the ear down to the xiphoid process, and then we would mark it with a piece of tape. Alright, then we are going to put the end of our tube in some lubrication. We are going to tell our patient why he's getting the procedure and that we are about to begin. Okay, so we would ask him to tilt his head backwards, and we would slide it on up his nose. Alright. Now as we're sliding, we're going to check in his mouth to make sure it's not coiling in the back. Once we can see it in the back of the mouth, we're going to have him tilt his head forward. Then we're going to ask him to swallow, swallow, swallow. We can even provide him with water and a straw to aid in getting the tube down. Okay. Once the tube had reached its desired position and was in all the way to where we marked it with the tape, we would secure it to his face. And then we are going to aspirate to check placement. So we'll hook up our syringe to our tubing. And we're going to pull back 30 milliliters. And it is greenish yellow, which matches what we expect for stomach contents. Alright, then listen on the stomach as we insert it back in. Yes, we hear a swishing, gurgling sound, so we know it's in the right place. To check placement, we would also ask the patient his name. We could get a chest x-ray to ensure placement, or we could test the contents for pH to make sure that they were of appropriate acidity. Alright, so once we have checked its placement, we could finish securing it to his face. Alright, then we could remove this and hook it up to the suction. Okay, and then we would document the size of the tubing, the type of tubing, the reason that it's being given, the time that we put it in, any ins and outs, that we verified the orders against the MAR, and so that would be done. And then if there were an issue with the tube, say the patient was having pain, we would need to go back in and irrigate the tubing. So we would come in, recheck our MAR, put on new gloves. We would disconnect from the tube or from the suction. Okay, then again we're going to want to aspirate and check the stomach contents. So pull back our 30 mils. Okay, it is still of green and yellowish color. Okay, so it's what we're looking for. We'll listen again to make sure we hear a swishy gurgly noise. Alright, so it all sounds good. So then we can pink it, and we're going to irrigate it. So we'll draw up 30 mLs of water, sterile water or saline. Alright, we'll hook it back to our tubing. Okay, we're going to slowly flush and push it in. Then we are going to aspirate one more time, hopefully. And we want to make sure we get the same amount of return as what we originally put in. So we're looking for that 30 mLs. If we didn't get it, we would continue irrigating and aspirating until we did get the amount we put in. Okay, so one more time. We'll make sure it goes in the right place. Alright, which it does. So we'll disconnect it and then hook it back up to the suction. At this point we would go back in, we would document time, date, what procedure was done, what our findings were of the stomach contents, how our patient handled it if his pain decreased after the irrigation, and that's it. You still didn't stop it.